POCD, otherwise known as paedophile-themed obsessive-compulsive disorder, is a relatively recently categorized form of OCD. Previous research suggests sexual obsessions affect between 13 and 21% of all individuals with OCD. Notably, these sexual obsessions may include fears of being sexually attracted to or sexually harming children, or what is known as POCD. Research seems to suggest that POCD is one of the most common forms of OCD. So let's break this down a bit first. What is OCD? OCD is an anxiety disorder that involves obsessive, unwanted, and therefore intrusive thoughts and feelings, and compulsive responses or behaviors due to those thoughts or feelings. These behaviors can take the form of cognitive, so that is thinking, responses, like counting or reassuring oneself, or behavioural ones, which might involve checking, washing, or repeatedly turning a light switch on and off. But the obsessions and compulsions will normally have a fear-based theme. For example, if you have a fear about contamination, you're likely to wash your hands several times a day. If you have a fear about you and your family's safety, you may compulsively check door locks or the gas hob. Of course, with POCD, the fear relates to paedophilia. People with POCD will often experience a threat to identity because sufferers experience obsessive thoughts and fears about being a paedophile or becoming one. POCD is possibly the worst type of OCD because it's the most horrifying obsession one might imagine. For example, sufferers will have repeated and unwanted sexual thoughts about children. These are incredibly confusing and upsetting. This makes the sufferer feel out of control, and as with other forms of OCD, this will mean they feel compelled to do things to help them regain control. Ironically though, when they act out on compulsions, they demonstrate their lack of control because their behavior is guided by anxiety rather than a wish to do the thing they feel compelled to. So let's review the kinds of thoughts someone with POCD might suffer. These may relate to thoughts, images, or sensations that involve harming children and are sexual and feel intrusive in nature. Sometimes innocent childhood memories can surface and take a sinister tone. For one client who had recently become a mother for the second time, a common sexual childhood game was recalled, causing her to fear she was a paedophile. Remembering a childhood crush when one was a child can become distorted and feel to the thinker like a suppressed paedophilic memory. And some sufferers' intrusive thoughts don't necessarily mean they fear they are a paedophile. Rather, these thoughts will prevent them from being happy and make them fear that they will gradually become a paedophile. Victims of childhood sexual abuse can believe they will do the same to a child. Now, sufferers can misinterpret thoughts about a child's appearance. For example, if you think a child is cute, you might worry about your sexual intentions towards that child. In fact, any positive thoughts or feelings towards children are feared to be sexual in nature, and inadvertent physical contact with a child is believed to be intentional and driven by pleasure. Some sufferers also worry because they obsessively experience false memories about having harmed a child, which they believe were repressed memories. And some people worry that noticing adult characteristics in young and developing children, such as the way they're dressed or body parts, indicates paedophilia. And for others, it might be things like second-guessing behaviors and intentions towards their own children or around children they know, which they never would have before. For example, why did I give him that toy? I must be trying to groom him. So let's talk about the compulsions or behaviors that someone with POCD might have. So sufferers might start to avoid children. Things that remind of children and therefore trigger thoughts will also be avoided. For example, children's TV shows. They may be very conscious of how to interact with children and therefore hold them in very deliberate ways, so that the child cannot brush genitalia. Intimacy and sex with one's partner might be avoided due to fear of paedophilic thoughts. Also, individuals will start to think about all their behavior around children as being ill-intended and questionable, when previously the same behavior would be perfectly acceptable. This might be, for example, doing or saying something nice to a child that they know. And some people will tell close friends or family about paedophilic thoughts so others can reassure them that they have POCD and that they're not a paedophile, and that their behavior is not inappropriate, which also means they're not a paedophile. Some people will reassure themselves about having confessed their thoughts to others, as this means they are not hiding anything. And another form of reassurance is to repeat a behavior to prove to themselves that no wrong or sexual act took place. For example, interacting with a child more than they normally might, or picking up and putting down a child repeatedly. Others will obsessively research about POCD and actual paedophilia to try to differentiate between the two. And then there are those who keep records of where they have been to confirm and reassure that they haven't molested a child. And there's the idea of checking if being around children or having thoughts of them results in arousal in the groin or anywhere else. Some people will also imagine and check for signs of abuse in children when with them. And others will take extra precautions around children, like putting trousers on to go to the bathroom at night, rather than passing a child's room in boxer shorts. Paedophiles are detested by society, and it's important to remember this is also true for the sufferer. This is why they feel intense fear at the idea of being a paedophile. Indeed, the worst forms of OCD are combined in POCD. That is, a fear of hurting vulnerable people, which is known as harm OCD, the fear of being attracted to someone we shouldn't be, which is known as sexual orientation OCD, and a fear of breaking the strictest codes of society. So it's important to get help rather than suffer alone. Remember, POCD is like other forms of OCD. It's a recognized anxiety disorder that can be treated to offer relief to the sufferer. If you or someone you know experiences POCD, do subscribe and look out for our second video, which will explore the help available to sufferers. Alternatively, you can check out our blogs on our website or book a free consultation if you wish to begin therapy now. Just don't suffer alone. Bye for now.